Setting up a new EMR for any office can be a daunting task. We try to make it a little easier in Visions by giving you these icons in the setup portion of the program to guide you through some of the more important things that need to be set up in order for the EMR to work properly for your office. To get to this part of the program, you first need to have a user with administrative privileges to get into this screen. To get here, click on the Admin button at the top and then Setup over on the left to bring you to this screen here. Here the icons are set up in alphabetical order, so they don't necessarily relate to each other other than through the alphabet. We start off with allergies. Now, allergies has 4 options to set up: the allergies themselves, allergic intensity, allergy status, and allergy type. These are all related to meaningful use. So if you participate with meaningful use, then you will need to set these up. They're very easy to do and self-explanatory. We'll skip to the next one, which is the claim indicator code. This is something you probably won't need to set up because the claim indicator code is pretty universal for most of us, and it comes pre-set up with most of the common claim indicators that we would use. The next is simply coatings that are used for spectacles, glasses, lenses in particular. So coatings like anti-reflective, mirror coatings, tints, scratch coatings, things like that. Contacts are your contact lenses. The program comes preloaded with a number of contact lenses, but you'll need to go through this, find and or add the lenses that you use in the office, and then add the appropriate codes and fees that go along with that. We'll skip descriptor and descriptor type for now. Diagnosis is your diagnosis codes, and again the program comes preloaded with over 1,000 common ocular diagnoses with their codes. You can change this and set it up to whatever is appropriate for your office if you find the need to do that. Diagnosis status and diagnosis type again are more important if you're doing meaningful use. But we can skip those for now and go to doctors. Doctors is of course very important because here you'll need to set up the doctors in your office. Now, a doctor that practices in your office or in your clinic is called a member doctor, and you'll need to indicate that here. If you are going to send letters, refer patients out, you'll need to set up other doctors in your area. You might not need all of this information, but you'll definitely need to get their name in there at least. And those are not member doctors, and they'll show up in different parts of the program. Drug setting is particular to meaningful use. Again, we'll skip that for now and move on to the drugs icon here. And the program again comes preloaded with a number of ophthalmic pharmaceutical items here, and if what you use is not here, certainly you can add a new item, or if you find that the list is too long, you can delete some of these or modify them if you like. You can modify any of the items by clicking the select button, and that holds true throughout the program. The education buttons, education relation, article, and category, again, all refer to meaningful use, and here you would simply set up the articles and then relate them to the types of either diagnoses, particular drugs, allergies, and other conditions that may occur with your patients. And that way, when those conditions are triggered in the patient's file, the proper education resources will come up when you press the button. Ethnicity is preloaded, and you can change or add to that if you like, but generally not necessary. Frequency is very simple. This is the frequency that you would prescribe pharmaceutical items. And again, it's preloaded with the most common frequencies: QID, TID, BID, HS, QD, etc. Individual relationship code and insurance type code are related to your claims, electronic or paper. And again, the program comes pre-set up with these types of codes and descriptions. You can add or subtract from those as you see fit. Lab is the labs that you use for glasses and or contacts. Again, some labs are preloaded here. You can certainly change those to the ones that you use. Lab test and lab test type are related to meaningful use. Lab tests are the actual tests that you would order. Let's say a chest x-ray or hemoglobin, A1C, or those kinds of tests. Whereas the test type is exactly that. It's the type of test you're ordering. Imaging, chemistry, hematology. And again, you can change these if you see need to do that. Languages, self-explanatory, so languages that your patients speak and that, again, related to meaningful use. Lenses is your spectacle lenses and pricing that goes along with them. The program comes preloaded with a number of different types of lenses, but of course there are so many different lenses out there that you could be using. You'll need to go through this list, find the ones that you use and or add new ones and change the pricing to what would be appropriate for your office. Tints, self-explanatory. Mounting is used in the lab order, and there's a few mountings here which are standard, drilled, and rimless. Occupation list, self-explanatory. Order status. This is you can add jobs to a report called jobs on order. So if you're ordering glasses for a person, for a patient, if you're ordering contact lenses, you can add them to this list. The order status is what's happening with that job. Is it in process? Is it pending? Has it been received? Was it sent back? Has it been completed? You can add or subtract different terminology there. Order type is very similar. It's whether it's on order, on hold, not ordered, or pending. Okay, we're going to stop there for this lesson. We'll pick up the rest of the setup in the next tutorial.